Hi, my name is Carrie Forhetz, and I'm a PA student at Lipscomb's Physician Assistant Program. And my practicum project dealt with acute respiratory distress syndrome, otherwise known as ARDS, and the use of neuromuscular blocking agents, specifically in looking at mortality rates and benefit. So acute respiratory distress syndrome is a severe life-threatening condition, typically resulting from some type of systemic injury, usually sepsis, causing a mass inflammation of the lungs, fluid to build up in the alveoli, and an impairment of oxygenation and gas exchange at the lungs. So this is a significant disease. These patients are really sick. There's a mortality rate of 45%, and there's a high morbidity along with it as well. So far, pharmacologic agents have not been studied with very much success in moderate to severe ARDS. So I'm looking at specifically neuromuscular blocking agents, really just cisatracurium versus a placebo in these two trials and studies that I'm looking at. So the two landmark trials with conflicting evidence that I found was 2010 ARDS trial, which basically laid the foundation and framework for using neuromuscular blockers in ARDS. And the 2019 ROSE trial, which was basically a reevaluation of the ARDS trial. So they designed the 2019 ROSE trial to actually support the findings of ARDS. However, that is not what they found. So looking at the results of the actual studies, the 2010 ARDS trial did find that there was a 90-day mortality rate benefit and decrease in mortality rate at 90 days, whereas the 2019 ROSE trial did not find that. The 90-day mortality rate was not statistically significant. And the 2019 ROSE trial actually found that there was one significant secondary outcome, and that was serious cardiovascular events. So whereas ROSE was expecting to support the findings of ARDS, to further support the use of cisatracurium in ARDS, that's not what they found, and actually found that there were some serious heart adverse events. And there are some differences a little bit in sedation differences and adjustments for a few baseline characteristics, but overall the studies were designed very similarly, and ROSE, which had over 1,000 patients, and ARDS, which only had 340 patients enrolled, they were completely different findings. So however, at this time, the early use of neuromuscular blocking agents in moderate to severe ARDS does not decrease mortality benefit or rate, and at this time, from my research and what my conclusion is, that neuromuscular blockers should only be used as salvage therapy in moderate to severe ARDS. Now, if patients continue to have patient ventilator dyssynchrony, then you could try a trial of neuromuscular blocking agents. But in conclusion, with the findings of the 2019 ROSE trial, the neuromuscular blockers should only be used as salvage therapy at this point. And that concludes my poster. So thank you so much for listening.